That was very nice. I was, as you were speaking, guys, wondering who you were talking about. Anyway, I appreciate coming back here. Last time I was wearing a suit and tie. This time it's a sports jacket and slacks. Next time it'll be jeans. And by the annual meeting in May, I'm going to be wearing shorts. So we're going to have some fun. This is a family, and it's a family show. So anyway, what was very important for me to hear today, and I'm very excited about this because my motivation for getting into this was to see a very good product get into people and be used. And I'm very excited by the fact that our arrangement with Engage Global now allows that, and you leaders will promulgate that. And now that I understand a little bit more about your compensation plan and everything you're doing, I need to buy that Fast Start thing. So, anyway, no, this was very good. What I think I'll do in a short time today, and I will expand on this at the annual meeting in May. And many of you I recognize from the launch that we had last month. And so what I thought would be good is just hit some highlights about this, not try to give you a deep scientific message, because you're going to be the group that's going to be telling the next generation of members about this. And I want to just leave you with some key messaging to use and some things not to say. To start, I'm really excited about the new packaging, and I'm really excited about we were finally able to get the actual military green that we couldn't get for Iraq. The nice thing about the new capsules is that we're actually, because of the coloring, we were able to now decrease the amount of silica, decrease the amount of magnesium stearate, decrease the amount of cellulose gelatin in the capsule, so it actually makes it even healthier, which is really cool, besides the color, so I'm very happy about that. Somebody asked about genetically modified products. We wouldn't consider using anything like that, so don't worry about that. The other question is that if you open the capsule, you may notice some of the very finer powder form. The technology has really advanced since 7 years ago when we developed the initial military micronutrient formulation. So I really do like the fact that we can actually have some very more accurate dosing, and I like the way the ratios come out with a finer powder. So for those of you who noticed that, don't be alarmed. It's in fact the same product, but it's a very nicer, finer, more technically appropriate formulation type. So that's good. I also heard the questions about some of you, and I have a confession to make too. We're all pet people, or many of us are. There have been pets whose joints have been benefited from taking little bits of some of our formulations. But in talking with Jason and with David over the next 6 to 12 months, if this explodes the way I think it will, there probably will be some product line enhancements and extensions. We'll look at youth. We have formulations specifically for younger people, specifically for the elderly, and in fact specifically for both small and large animals. So that is something that is in the offing, and I'm excited to hear that there's interest in that. What I think we'll do is pretty rapidly go through some of the scientific slides, because I want to really leave you. Forgive me for interrupting. I'm sorry. Can you hear him better now? I just turned it up in the back. More volume? Sorry, they're having a hard time hearing you. There's a lot of noise behind us. Oh. You want me to just stand on this side and then on that side? There's a bright light. Okay. Don't go into the light. Here. Okay. All right. I tend to walk around, so I apologize. We're going to go through some highlights, just some highlights. The messaging, I'm getting a big, some sort of a feedback. If you can kind of keep yourself turned this way. There. Just like that. This goes against everything I've ever done with lectures, but if I were speaking to a room of medical students and residents and I stayed just like this, I would have lost them in about 5 minutes. They'd be snoring. So I will try not to move. Anyway, what I want to do is give you some highlights. The science behind this is complex and in depth, and it took many, many years to develop it. And I don't want to put you in a position of getting deep into the scientific weeds. So what I'd like to do is give you some highlights about the kinds of things you can say and should say. And I want you also not to have to overhype the medical benefits. The important thing about this product is not to say this is good for this condition or it's good for that condition. That's really not the message here. What we've been able to formulate in a world where most of the people, and this is a fact in the United States, most of the people who are in the middle class and above already either personally take some supplement, have a great interest in them, or members of their family do. So the message for us is, if you're going to take something anyway, why don't you take the best product? Take the one that's been the most studied, has the most clinical credibility, and has third-party credibility with, say, like the Department of Defense and NASA, because there's no competing product in the network marketing world that can say that. What I think, free radicals are things that everybody sort of knows, but basically what they are just the normal outcome of normal metabolism. What happens in your body every day when you eat, when you exercise, when you breathe the air, as bad as the air is in some places, although we're sort of lucky in Colorado and Utah. Okay. We're sort of lucky in Colorado and Utah because we got a pretty good sky where we are. We really are blessed, and we got some beautiful mountains in both states. So our air is actually not too bad. But the reality is that the environment causes a lot of oxidative damage through free radical elaboration. And the message for the people you want to talk to is, it's a hostile environment out there. We can't avoid it. We have ozone exposure. We have exposure to viruses. We have exposure to either first-hand or second-hand smoke, or in some cases of very young fetuses, third-hand smoke now, we know. So we have exposure to stressors that turn on this oxidative system and cause free radicals. You can't avoid it until you're dead. When you're dead, it's not an issue. So for any of you who want to sign up dead people, we can't give them the scientific backup that you need. But for people who are living, we can do some good things. Now, what does oxidative damage do? Oxidative damage attacks certain parts of the body, and there are 3 specific areas, for those of you who want to get into the science, that in fact we can help with MMF. Oxidative damage attacks the lining of our cells, these lipid fat made up linings. It also attacks the DNA of the cell, and it also attacks the proteins in our body and our tissues. And the reason we know that we're effective is not only because of the clinical findings, but when we measure these scientific parameters, we measure lipid peroxidation, we measure DNA abnormalities of DNA, and we can measure altered proteins. When we did that in our studies with the Department of Defense, and we did it in our studies with NASA, we were able to find that MMF, in fact, stopped those processes. That's why we see the results that we see. Now, let me give you a hint about the people that you're going to tell about this product. Oxidative damage mixes with inflammation almost always. It also interferes with immune function. So those 3 factors are related to the things that the people you're going to tell about MMF are feeling or are suffering from. So it's very important to say that don't be sort of alarmed if in the first couple of weeks or 3 weeks of MMF, people feel funny things. Some people may feel some upset. Some people may feel some joints feeling a little more sore. Some people may feel a little hyper. Some people may get flushed. Some people may even have some blood pressure increase that they notice. Some people may, if they are pre-diabetics or have diabetic risk or are diabetics, may even see some blood pressure spikes for this short period of time. And here's the reason. What's happening is their body has never seen this level of antioxidant benefit. It has never seen this combination and ratio of dietary antioxidants, endogenous antioxidants, and glutathione elevating agents that in fact cause the abrogation of this oxidative damage or oxidative stress. So everyone is resetting their body to a different level of antioxidant status. During that time period, in the thousands and thousands of people that I've seen on this product, as well as our studies with the military, we see some of those changes, and it scares people. They say, "Oh gosh, I'm sore now, and I wasn't sore 5 days ago." They will get through that, and then what will happen? And it's usually in about week 2 to week 3, once they have reset, that suddenly there's some incredible benefits that virtually everybody will feel. Virtually everybody will feel. Sleep pattern improvement is one of the major ones. Morning energy is clearly seen in about 90% of people. The joints are more flexible. The joint pain gets better because of the anti-inflammatory effect. Those are seen almost uniformly. The other thing that happens, which is sort of interesting, there's some neuroprocessing connections in the cortex, in the brain, and in the peripheral neural system that are very, very sensitive to oxidative damage and inflammation. And when you drop that oxidative damage and inflammation, you, in fact, enhance that processing. So there's some hyper-awareness that goes on. Some people literally start thinking clearer. And very interestingly, we've seen, and this is something that we've talked with Marty and Angela about, is sometimes young people who have some attention deficit of neural processing actually improve. And we've seen this in pediatric practice routinely. The other thing that we've seen is some really nice benefits in neuromuscular diseases. Now, again, we do not talk about MMF for any disease. Let me say that again. We do not talk about MMF for any disease. Any benefits that's seen, and they will be seen, both in blood sugar, hemoglobin A1C, cardiac parameters, lipid parameters, I'll show you some data, those benefits are going to come. But we do not talk about MMF for those benefits. If we do, the FDA and FTC could come in here and close this company. We cannot make those claims. Let me say it again. We cannot make those claims. This is a supplement. So we are under those Deshay laws. Those are the laws set by the U.S. Congress in 1993 and 94 about what we cannot say. And I emphasize it because in a network marketing environment, and I didn't know much about network marketing until I met Jason and David, but I've been reading about it, and I've been going online. I've been talking to executives from these companies, and some of the hype and some of the stuff that is said is really downright frightening, besides being dishonest, but it's frightening. So we don't need to do that here in Engage. We just don't. MMF is strong enough, it's good enough, it will provide enough benefit, you don't have to hype it. Now, what are the benefits, what conditions? This slide actually highlights a lot of the conditions that oxidative damage affects. So what you would expect with MMF and what we see is some benefits in these different areas of your body. I will go into much more detail when we actually have our annual meeting and we have a lot more time to talk about it. Now, the mechanisms of damage are uniform. In other words, there are many different things that each of us is exposed to that cause oxidative stress in our bodies, but there are several final common pathways. And it took organized medicine a while to understand that. And it really wasn't until 2002 that the first article in the Journal of the American Medical Association came out. In 2002, it took a long time because, you know, supplements have been known about since the 1930s and 40s in the United States. The Merck manual came out in the 1950s. So all of those RDAs and all those things about vitamins that you read about, you know, go back 70 years. But in 2002, the AMA finally said, yes, it is true that oxidative damage does impact certain conditions in the body. And then the following year in the Annals of Internal Medicine, it was admitted by the authors of that article that complications of serious illnesses are related to this oxidative damage and inflammatory cycle. So if you can do something about it, and MMF is probably the best at it, you can abrogate or decrease some of those things. And then finally, just a couple of years ago, in the Journal of the American Medical Association, they actually linked that with several more serious diseases, including cancer. So we know we're on the right track. We know the research we're doing is in the right environment, and we know we can provide benefit. One of the nice things about this company and this, you know, you, the members, is that we can take advantage through Engage Global of the excellent antioxidant and clinical science that we brought to MMF. We can take advantage of the third-party credibility that we gained from working with the Department of Defense, with NASA, being funded by Congress. Congress gave us many, many millions of dollars to do this research. So we weren't bought and paid for by some drug company. This was done congressionally. And also, we were able to have unique formulations that were patented because we were able to do laboratory work, animal work, and human clinical trials. So we have credibility. You have credibility. MMF has credibility. So that's what you can tell people. And we, you know, obviously Jason and David, in the materials they provide you, will be giving you more and more of that background science. The safety record is on a sale. We've not had a safety problem in about 15 years of the use of these formulations, either in our clinical trials or with people. We also, all of the micronutrients that are used have been in the public venue for 50 years without problems at the doses and the ratios we use. I will comment about one thing. Some people have never seen this level of antioxidation, so they get stomach upset. How many of you have seen that with some of the people that have tried? They do get some stomach upset because their body has to get used to this gold level, if you will, of antioxidation. If they get stomach upset, what I usually recommend is they drop the dose in half. Instead of 2 capsules and 2 capsules, go to 1 and 1. If they still are upset after 2 or 3 days, give them about a 5-day break and then restart. Rarely, but occasionally, somebody might get a little bit of diarrhea because of the stomach upset. It causes some hyperperistalsis, causes the bowel to work a little quicker. If that happens, no problem, just back off. Give them a 5-day break and then restart with half the dose. 95% of the time, that will do it. 95% of the time, that will do it. Occasionally, you will run into a person, you know, we're all human beings, we're all different, and idiosyncratic reactions do occur. Anything you put in your body can cause that kind of a reaction. So if there is somebody who absolutely, after 2 or 3 trials, cannot tolerate this level of antioxidation, then unfortunately they probably cannot tolerate the MMF. As we come in with some extensions of the product in coming months, there'll be some modulations of the formulations that may be easier. But this should be 1 in 1,000. This should be very rare, but it will happen. Don't be shocked if it happens. And if it happens twice, then just consider yourself having bad luck. Because, you know, I've been doing this now for about antioxidant science now for about 18 years. And it's rare that we see this kind of stuff, but it does happen. So just be aware. Now, the functions of the antioxidants and what is in MMF are varied. It goes everywhere from cell signaling to genetic changes, which I'll show you a slide right next about that. And it also decreases free radical-induced oxidative damage, decreases inflammation, enhances the immune function. Those are known things. Those are things we've studied. They occur. I'll show you data on it. They absolutely happen. Nobody can tell you they don't. If your doctor doesn't believe it, you know, they can reach me through the company. And believe me, I've talked to not only a room full of doctors, twice the size of this from the DOD. I've talked to study sections at the NIH. I met 2 MDs yesterday who were very skeptical. Spent about 20 minutes with them, and they both signed up. So just, you know, I understand that there is skepticism about supplementation. I understand, even worse, that there's skepticism about network marketing. And you put network marketing and supplementation together, you get a lot of skepticism. MMF is different. It is studied, it is patented, it is credible, it is published, and it has an enormous amount of human data. There are some companies out there, because I've been on their websites, and they say, oh, go to PubMed and look us up, you'll see all these studies. Well, I've done that, and I can tell you they're all animal studies, and any human studies usually are not positive. So, you know, the other thing about human behavior, there are some people who are leaders, there are some people who are followers, there are some people who are in the middle of the group, but there are some people who are just doubting Thomases. You know what? Don't spend the time with those people. You know, there's no reason to spend an hour trying to beat somebody over the head with information and data if they're not open to it. That's okay. You know, even in my practice, sometimes I'll say, you know, to a patient or to the parents, if it's a pediatric patient, this is a course of therapy that we think will work. And then they'll say, doctor, you said you think. Well, what, don't you know? And I'll say, well, yeah, you know, I do know the information and the data, but your child is one of a million. And I don't, you know, I can't guarantee it. If that's not good enough for you, if my experience and my expertise and my credibility is not good enough for you, that's fine. There's a lot of other doctors. There's a lot of other hospitals. I'm not going to sit here and twist your arm. What I'll do is I'll give you honest information. You processed it, and you tell me if my recommendation makes sense to you. This is a partnership. Showing MMF to your friends is a partnership. If they are open to it, I think they will find the information compelling. On the other hand, if they are doubting Thomases, if they just want to sit there and criticize, or if they fold their arms and say, talk me into this if you can, don't waste your time. It's not worth it. There's too many other people that we can help. This shows, the next slide was the genetic studies that I was telling you about. And basically what we just show here is that red is upregulated and blue is downregulated. That just shows the incredible genetic impact we can have with MMF. This was done in human cell lines, and that's exactly what's going on in your body. So we, in fact, not only change antioxidation in your body, but we change, in fact, tissue level, cellular level, DNA level, genetic level, and we modulate these things with the proper formulation, which I'm going to tell you about in a second. By the way, this is just a picture from our NASA study where we used a product to protect the lung because environmental and things that you take in by breathing happen to be a highly toxic environment. So we were able to show a difference between the protected and the unprotected lung in an animal model. Animals are great, but they're not humans. So what we needed to do was then go to a human model, and we had several. And one of we did two things in the study that this slide talks about. One was a volunteer civilian model in a high oxidative environment, which was actually in South America. And these people all smoke and they all eat beef 3 times a day. So the rates of diabetes, the rates of cancer and serious mutagenic diseases is quite high. And so what we did was we used them for the study. And then in the second study, we looked at similar exposures in a military training environment. This happened to be at the Mountain Warfare Training Center in 29 Palms, California. I don't know if you all know where that is, but it's pretty rugged. And we had these really rugged, very well-muscled, very attractive 18 to 22-year-old men. It all happen to be men. The Marines do have some women now, but these happen to be men in this study. And after 12 weeks of being beaten up at the Mountain Warfare Training Center, they're pretty low. So these were two really good groups to study. So what did we find? Well, in the civilian study, it was very interesting. The green line shows a measure of lipid peroxidation, MDA or malondialdehyde, which is a very sensitive marker in both the urine and the blood. And this was a 6-month study. So we were able to show that over 6 months of taking the product, these people were able to continuously lower their oxidative damage throughout the entire time. And I suspect it would have gone even further had we gone beyond 6 months. But we got a bonus here. We got a bonus. The scientist who ran the study, Dr. Zulema Kappas, she's a very smart lady, and she said, why don't we look at cellular immunity, because these people are acting so much better, doing so much better, having much better energy. What if their immune system, and they're not getting sick, so let's measure their immune system. So we did something called the lymphocyte transformation assay, which is an assay where you actually look at the blood of these people and see when you give an antigen challenge, like a cold or a virus or something, how many of their lymphocytes transform into a killer form, into a form that goes after the virus. So that's a good measure, a very, very good measure of your immune system. And what we found was a surprise. Throughout taking the product, that lymphocyte transformation assay increased, and it increased from about 55% transformed lymphocytes to about 75%. Really cool, right into the sweet spot. What we didn't want to do is overstimulate them. In other words, we don't want to cause an immune disease. But it was very, very exciting information, and that told me why we saw a lot less colds and a lot less intercurrent viruses and other things in people who were taking the product. In the military trial, we found something very interesting also. I don't know if this shows. This does show. Basically, we beat down these Marines after 12 weeks of being in the Mountain Warfare Training Center, and their oxidative damage went sky high. In this case, we measured it with a DNA marker called 8-hydroxydeoxyguanosine. There will be a test on this. You're going to be asked that to leave the room. And so any of you who can't spell it, you're out of luck. You just dropped down from gold, back down one more, So anyway, Jason said I could save money that way of the company. But anyway, so what we did was we measured this marker in these Marines. And what was really interesting was that not only the fact that we were able to decrease the oxidative damage, but by how much we decreased it. We took it all the way down to 29% when it started, much, much higher. And so what we were able to show in that environment, as opposed to the civilians, was that even under stress, and I can assure you these Marines were stressed, even under stress, we were able to decrease the oxidative damage with MMF. So very exciting stuff. Then what we decided to do, and you guys all saw the packets at the beginning, we actually were approved. We were the only group that was approved by the U.S. Department of Defense Institution Review Board to actually give this product to U.S. operating forces. No other multi-level marketing company can say that, but you can say it. So what we did was these were Marines who were actually injured in the Sunni Triangle in El Anbar province in Iraq. And then we got them back to a cache in the south where my partner, Major Carr, was taking, actually he's now Colonel Carr, but he was taking care of them. And then they were transported to Landstuhl in Germany, which is the U.S. base for medical care, and then transported to the Naval Medical Center in San Diego. And we did a randomized prospective study, blinded study on them, and what we found was really rather remarkable. All of them got standard treatment. They got concussive injuries, they got standard treatment, they got vestibular rehabilitation and supportive care and physical therapy and steroids. And one group got our product. Nobody knew who was getting what. The findings were really rather remarkable. At the end of just 4 weeks, the sensory organization score by computerized dynamic posturography, which is a very sophisticated medical test, showed a statistically significant difference between group 1 and group 2. By 8 weeks, all of these indices were better in one group than the other, including gait indices, dizziness handicap index, balance scoring systems, a lot of indices that are used in medicine. And by 12 weeks, we even had energy indices, quality of life scores, both done by the physical therapist as well as done by the Marines themselves, and they were always better in one group than the other. We then broke the blind, and I guess we wouldn't be here talking about it if MMF hadn't been better, but the group that was getting the MMF was remarkably better than the other group. That, again, has never been shown before. So now we have it in the lab, we have it in animals, and we have it in 3 sets of humans, including 1 set of civilians, 1 set of military people who were undergoing stress, and 1 set of military people who were injured. Very exciting information. I published it in the American Journal of Otolaryngology in 2011, 2012, something like that. And so that is published. It is credible. These are randomized prospective clinical human trials. No other multi-level marketing company has them. So let's go to the last thing I want to just talk about briefly in this one, and that's atherosclerosis. Atherosclerosis is a progressive disease. It gets worse as you get older. So what we thought was, we knew that it's not the LDL that kills you, but it's the oxidized LDL. So in other words, before the lining of your vessels gets all perturbed with those macrophages and platelets to sit there. You've all seen that commercial on TV where the platelets all get on that clot, you know, and block the vessel. Well, you need to have oxidation for that to occur. And with free radical-induced oxidative damage and inflammation, it occurs at a very high way. So what we did was we were able to work with the first responders. As our studies became known, police and fire departments would come to us about their health issues. And I found out that firemen, I thought firemen died of lung disease. I thought they would inhale noxious fumes and they would get in trouble with lung disease. Turns out it's not lung disease. Turns out what kills firefighters is heart disease. And the reason is they sit there for 24 hours, you know, watching TV, eating food, and then all of a sudden they get called. And they got to run to this event, this very high stress event where the adrenaline levels go crazy, and they're in a life-threatening situation where there's a fire. So they die of heart disease, and they die young. It's very interesting data. So what we did was we took a study. We got approval for a study for 64 firefighters at South Metro Denver Fire Department, and we were actually looking at their lipids and advanced lipids, and we were looking at something called CIMT, or the carotid intimomedial thickness. Now, that's a very important measure, now been accepted by the American College of Cardiology as a sort of warning system for strokes and heart attacks. It's the age of your carotid artery. It's done with a 5-minute ultrasound. And I'm happy to say that my carotid artery is about 20 years younger than I actually am. So it's a very good test, and I thank God for that. But anyway, we decided to do that test. It's never really been done in a heart trial. So what we did with our product was put them on this for 2 years. So it's a 2-year study. And the findings are really remarkable. The cholesterol levels, the bad cholesterol went down, good cholesterol went up, triglycerides went down, the ratios improved. And very interestingly, the carotid IMT numbers, 52% of the people did not progress as they should have in the age of their carotids as they got older over these 2 years, and 48% actually regressed. Even a statin can't do that. Even rosuvastatin Crestor, the best statin we have, doesn't have that kind of data. So we were able to show that once again in another model, in another human clinical trial, we're able to abrogate a serious condition and improve these parameters in humans. So what are the critical aspects? What makes MMF different than vitamins off the shelf, than something that's being sold by, multi-level marketing company A or multi-level marketing company Z. The difference is the key elements of antioxidant science. And MMF is the only product that includes all of those elements. I will expand on this a little bit more when we have more time, but in general, we have to have the proper content, the proper ratios, the proper isoforms, the natural isoforms of the micronutrients to work, and we have to have them in the right doses and the right dose schedule. Let me just talk about dose schedule for a moment. It's very, very well known that fat-soluble and water-soluble vitamins or antioxidants have a half-life that varies for water-solubles between 4 and 6 hours, and for fat-solubles between 8 to 12 to 18 hours. So what happens is your body sees a peak, and then it sees a trough at about 12 hours. And at that time of that trough, your body will elaborate a gene, we used to call it DJ1, but it encodes for a stress protein. It tells your body, oh my God, I'm under stress. And that's because the body has seen a spike, and now it feels like it really needs antioxidants. The free radicals are just going crazy. So by using the dosing that you have with MMF every 12 hours approximately, or with dinner and with breakfast, you smooth out that curve. You never fire that gene, and you never get that stress protein. So what happens is when you take advantage of pharmacokinetics with your micronutrients so that your body always sees a good level and never sees a stressful component. The other thing I do want to mention is that it's not only important what's in the micronutrient, but what has been removed and not in the micronutrient. That's critical because in the typical thinking of people, they have an A to zinc mentality, and Centrum is guilty of that because they put it on TV. Well, it's not the list of all that crap that's in there. There's some things that shouldn't be there. For example, certain minerals, iron, copper, manganese, and others, and they're all in the multivitamin, but they react with vitamin C in either ascorbate form or ascorbic acid form, and through something called the Fenton reaction, make billions of free radicals. Do exactly the opposite of what you would want. They are pro-oxidative rather than anti-oxidative. So those kinds of formulations, and there are many multi-level marketing companies selling them, they don't work, and they're bad. The other thing that some of them have in them is some heavy metals. And you'll see them on the label. They're in the Centrum's label. They're in one a day's label. And so what happens is when you include those over time, they collect in the body and they become neurotoxic. Your body has no way to get rid of them in men of all ages and women after menopause, unless you get blood transfusions every month. So basically, it's antioxidant science. Let me say it again. It's antioxidant science. That's what makes MMF different. It's not just going to the store and going up to GNC and having some high school trained clerk tell you what to buy that month. That's not what you want to do. And in fact, if you grabbed all the different components of MMF and tried to put them together, first of all, you wouldn't have them in the right isoforms, you wouldn't have them in the right ratios, but even if you tried and you put them together, the approximate retail cost on the shelf would be somewhere around $150. So MMF is not only appropriate, but it's a bargain. Now, safety. Everybody cares about safety. It's the most important thing. And what is really, really neat about these formulations is that all of the ingredients in the MMF formulation have been in public use for over 50 years safely. For 15 years in the combination, we've been using them safely. For anecdotal use by individuals safely. And in every one of our clinical trials, no adverse events from the micronutrients. Can people get a stomach ache? Yeah, some of your friends have. So there's some minor things that can happen. There's some idiosyncratic reactions that can happen. But from the safety standpoint, this is safer than aspirin. So basically, last slide, or actually second from last slide. There are two more slides. There have been some talks about antioxidant enzymes. And there are some companies that are hyping things that have antioxidant enzymes. And I just want to say that there are two systems in the body that do affect oxidative damage and oxidative stress. One is the glutathione system, which is the body's most important antioxidant, which we deal with here in MMF. And there's a thyroredoxin system, which is the enzymes. What is important to realize is that they both work. They're complementary. They overlap. However, the glutathione system has a couple of advantages. Number one, the glutathione system will respond to oxidative damage that is acute or is chronic, is there for a long period of time. The thyroredoxin system only responds to acute oxidative stress. The second advantage is that glutathione will not only directly quench free radicals and directly decrease oxidative damage, but in fact, it itself can activate the enzyme system. So it has a double benefit. And lastly, and most importantly, in the human trials with our system, MMF, as I've published, it worked. And in the publication of at least one study using the thyroredoxin system in the American Journal of Physiology in 2012, that item failed. So if you hear about enzyme systems from other companies, they're okay. They're complementary. It's another system that works. We just have a couple of advantages. So, final slide. What can we expect from our strategy with MMF? Well, there are many things we can expect. You know, we can expect a whole host of benefits. What we want to, however, say is this is not a product for this condition. Oh, you have diabetes? Try MMF. Oh, you have heart disease? Try MMF. Oh, you have arthritis? Try MMF. That is not the message we want to give. The message we want to give is, oh, you take supplements anyway, or your family does, or you're interested in supplements. If you're going to do that, take the one that is the best. Take the one that's the most studied. It's the most based on antioxidant science. It's the one that has the most clinical trials. And, by the way, it comes in under Engage Global. It's the only place you can get it. And Engage Global has a pretty neat program. Let me tell you about it. That's the message we should give. And I think if we do that, we're all going to be really, really happy in the coming months and years. Thank you for your attention. It's been fun. I don't really like standing in one place, but we got it done. So anyway, thank you.